hygiene and in patient safety is on the right things, enhancing knowledge, understanding of when to do the right thing. To those working in healthcare, those to support training ongoing, and those who are elements. Let's make sure that we train and educate them all in the same way to understand why hand hygiene is most important. 5. Hand hygiene training in every training and education programme that we will make it difficult for healthcare workers to do the right thing and to patient safety. This is a component of improvement, but it's a call to action to make sure that hygiene at the point of care is embedded in all training and education, not infection prevention sessions, but those examples to catheters and other clinical interventions. Let's make sure the patient is focused. Apologies on the screen. It's monitoring and feedback of the fans is monitoring of hand hygiene action is basis of care, and the feedback is valid and reliable. Make this on enhancing patient safety, on protecting. The next, the importance of people to do. Again, let's focus this on patient safety, which of care and for hand hygiene. Posters can be for people to be involved. WHO encourage and recommend this. It will be to the detriment of focus of patient safety at the point of patient care. Let us not focus too much on placing posters to the detriment of other components of this multimodal improvement strategy. The remind not distract from other activities, which are very important and need to be fresh and always there to prompt behaviours within healthcare, as healthcare are very busy. So a recent of multimodal strategy ensure we have a safety climate, a culture of patient safety. That will take different forms, but it's vital that our leaders with organisations understand and when hygiene is most important. And that is care. There are many in healthcare facilities focus on the care, because those are the times when those visible organisms in our environment will get into patients' bandages, get into systems, and cause harm. So we need to again the 5 moments. We help moments and have a culture for supporting action. So let's the improvement, which is tried and tested for hygiene, but for practices within healthcare, change, training, monitoring evaluation and feedback, remind places and behaviour change. We'll simplify language and say to teach it in order to enhance capability. Build organise what's going on in our organisations to make sure we have the opportunities to patient safety, we sell it, and live hygiene to be right organisational culture and motivates others and others to realise importance. Multimodal strategy and simplify into these terms. You can with a behaviour change model, ability, opportunity, and motivation that will action that will protect patients. Where patients bed in an LC, which does develop a strategy to change behaviour and focus on protecting our patients. Ahead of the time that we were going to take this first section that I WP improvement strategy, support implementation of the guidelines that were published in 2000 and they're available and based on all of the evidence that's been published on the topic, that the strategy is focusing on behaviours to fully implement strategy and support on a to ensure change and will be useful for you, and all of it is available on the WHO web pages. Now on for the rest of the time I have with you are the that can support health care in order to protect and ensure patient safety. Guidelines which are hundreds of pages long, have 40 tools that are available for in order to achieve hand hygiene improvement and sustainability. Of tools, if you and start then to absorb 2010 something the self-assessment framework. This is the facilities use it over and it's very powerful. I encourage you to use it, view the results, and patch and where help you complete framework and apply for awards in Europe and Asia Pacific and in Latin can actually work. One tool that WHO launched in 2010 to make progress. It's all about the temperature of your progress towards hand hygiene leadership. I'm going to go through it briefly. But where hand hygiene, it also still all those tools available for improvement in order component of the strategy. Spanish, Italian, Arabic, many languages, and we translate this in languages to WHO, where the by WHO colleagues that speak, and we use this on the WHO web pages to encourage others to use it. So, to help that WHO make any tools that they use, any recommendations that they make, are tried and tested in all regions of the world. As the first global patient safety challenge for global patient safety, challenge that acts as a useful solution. It's actually the whole world can talk together about their stories, share ideas, and you will infectious disease article that the immunology works in many countries. Same work was also, as you see on this screen. This number of things about its use and verifications for testing, and subsequently an article was published of this tool in the Journal of Hospital Infection in 2013. Of continued progress with hand movement in a systematic, reliable way, you're on the hand self-assessment framework. It's a reliable tool with information at the operational level, and do this temperature check as I mentioned, and it should take up to 2 hours to complete, as you see from the slide currently on my screen. I read each page, but not enough time to read all of it. I'm involved with different hospitals where we test up a hospital situation and understand how to complete it. So you understand what the teams mean and discuss how you got reliable and at operational level. This is in progress. I've noticed that we're hand hygiene and progress, but I found that in fact in some areas they were progress, or indeed based on recommendations, they had addressed some of the components of a multimodal improvement strategy. In many healthcare facilities, hand hygiene self-assessment framework will be very poor, but in doing better than they'd hoped, and to see how well they're doing, but it to see, and it allows us to senior management, to many others, to ensure they're available. To be connected to patient safety, to be a core part of it, to ensure visible to not cause harm. So, to do which I've explained, those components within the hand hygiene self-assessment framework. So it makes it easy easy to implement strategy. So the first is the first component of the strategy, which is change. Pay system change each steps that are required to that you can people act easily. So you can in your ability based on recommendations. You achieve the progress you have made, and in the WHO tools, you need to improve certain tools based on large toolkit available to you are recommended. So it's travel, directing your improved progress. Your scores are based on back about how about the aspects that will ensure and patients be protected at the moving on. The system and hygiene self-assessment framework. It shows the examples of the questions that are included and the two ended if you an system change to ensure on the next the hand hygiene self-assessment framework, training and education. Again, instructions, sources and recommendations for tools that can be used. No recommendations in the hand guidelines. How do healthcare workers regarding hand hygiene in your facility? Never, at least once, at least after professional categories or professional categories on commitment and then regular, at least annual training. Each instance. And there is a dedicated budget that allows for hand hygiene training. And how this tool is when you understand questions based on both the of what you're changing in healthcare based on of an improved strategy to look for budgets for action to ensure hand hygiene will be taken place in a patient safety activity. On the next third page of the framework, feedback, the multimodal improvement strategy. Educator scores on the next page, the fourth component of the strategy, workplace. Again, questions available. They're available to be viewed. Other leaflets and other readers. relevant scores, indicators, WHO exists, that to create your own tools, your own posters, your own videos, your own screensavers. And you can to help progress in this area if it is required once you complete your score in your organisation. And page in safety climate. A number of an organisation commitment to hygiene and indicators, scores, and regulatory tools. This is hygiene, and there is to the framework. One is with regard to components of the strategy. You then answer questions about your leadership ability, so that towards to always improve and sustain hand hygiene. You complete see on my screen for each of the components. You then add up your total, and for you will have a total. So for this is that they 50 out of 100 for system change. Do the 5 components, each of the pages, 4 for each section, each component. So your facility is currently functioning, and then the facility intermediate with a score of 5. Let's look at the leadership component mentioned. You complete if you're advanced stage. It's not that you use this tool for the component unless you have worked through each of the aspects and levels. Inadequate, basic, and through work done by WHO about those who complete the framework, that they are ready or advanced stage. To continue the framework and be all about the results in order how important hygiene is, how important of an improvement strategy are, state that we must not lose hand hygiene for people and must ensure it is sustained. So I would work PaSQ continues, how many completed this, and what the improvement support you through to become leaders in hand hygiene. Tools that are available that will help you progress through a double defense model improvement strategy to explain there's a way to understand how to start to progress through the assessment framework. Means we proposal Europe do this easy for people and have proven tools that as I have mentioned, so that you qualify and adapt setting. But the let's get to system here means and jobs outside at the exact are cared for, as well as the recommended WHO acts and continuous water supply, towels, hand washing is recommended, rag-based hand drop. Prepared tools to help implement the system change include soap and hand drop. This helps us are people it recommendations. It gives help us target education and training about wet products will be cleaned. Let's get to the importance of the point of care and the moment for hand hygiene. Available tools. Award facilities are structured. We will not make it easy for people to use the hand or to have access to continuous running water. And costing tool, purchasing product. That doesn't mean the first time you purchase it, but at all times when you're changing product. So they'll be sure that your healthcare facility is clear on budgets for such a product and the of it. We also have the production of alcohol hand job. Many use because of the costs, but also developing countries to get healthcare facilities. We have with us the pharmacy departments about producing their own hand job. Those who didn't have health hospitals. And it's just to ensure that low income settings can have hands. Cliche have to and accepting the use of hand job. We health from using this. People are often quick to say that the hand job has damaged their hands. If you understanding, tolerance and acceptability, it can be a true source of what issues if they feel they don't like products. We're very to use these tools, and we have available, which I'll recap on at the end. Training, like training, is clear, effective, and does regularly, and like the in-hand hygiene sessions, the things I've mentioned include having your hands when performing other procedures. Student whose session be to cannulate to an IV line, and her hands was told just we've done this. Encourage embedding of hand hygiene with for the student safety. It just change. It may continue to be viewed as an any other things that workers have to do. Let's ensure that we encourage hand hygiene in all institutions and education. WHO to help you train in slide sets, measure PowerPoint presentations that are available on the web pages, videos that can help you to see moments in those settings. We have sessions for you to present other people on hygiene. Clinical groups will be turned on convince elements about hand hygiene and their applications to help you do this. There are brochures and all of the information to you. Back on hand performance. Patients are safe. You can monitor the perceptions. No, you could prepare workers because we have data and figures to convince people of how important, because we are appropriate standards. Many feedback. I will note that you can see explain observation form, which I will come on to explain. Assumption of soap and hand rub. Data. Perceptions about the importance of culture and an organisation of leadership. Tools to organisational culture and the system and infrastructure change, but also feedback to convince lives and how critical for behaviour change. And of course, there's local ownership of such things because it makes people at local level that they are part of that change, they are part of what's to happen in their healthcare facility. But we want social reminders. We want to make control within the affect behaviour change. Therefore, available and limited to job, how to handle the 5 many times, good videos, WHO web pages of May, with more tools or information to support the strategy. And this is a new poster which I will show you at the end. And we'll screensaver, new videos, and other to the hand hygiene. I've strategies throughout the presentation because it is critical that you see the components, each of the components, while you choose between life based on your self-assessment framework completion. So remember the component, the safety climate, the organisational culture, we think that they want remitted an basis. This example of executives of hospitals are hospitals that they assist the clinics, making that they demonstrate their leadership. Tools from WHO, letters to convey about the importance, which can be culture for hand hygiene. Again, that we have available something that support organisations to demonstrate across the whole setting that they are committed to hand hygiene. Let's bring WHO populations, talked about workers, talked about and recommendations, what we aim to achieve for patient safety, action at the point of care. Germs, these invisible germs, get where they shouldn't be. The point is the place party, the patient care worker, and contact within that dotted line that you see in the 5 moments image and is presented. To the point of care, this is hand hygiene at takes place for patient harm. As we've said, to make sure hands can easily be cleaned at that point of care. Of course, it will be recommended that hands are washed and should go to a sink with running soap until moment. I want to reiterate the importance of this. This method is for prevention. In this day and age, there are many systems being developed around monitoring and electronically. It published a review paper saying that monitoring systems yet did not have the ability to monitor moments. So focus safety, observation at the care is still critical. WHO to use it. I want to emphasize towards the end of this presentation 5 moments why it's important to have every strategy based on moments help us to progress. A patient in a bed within a term as the patient zone. We want to change people's behaviours to think that we cross over that line of the patient zone, they must differently. They must feel differently about protecting that patient. So the patient before you must hands. Moment before touching a patient. Apologise. From what that moment 1 zone before those words are very important to remember the behaviour, and here are examples that at local level to help all workers understand what this means. Let's still focus when you exit zone and when you moment is followed by asking a patient, and he pulls the visible dotted line. You're going to ask the patient's protected So before you clean your hands, you clean your hands to the burden of that patient being transferred to the healthcare environment. That side of the dotted line where many patients mix, where they're many contaminated, in the patient zone where patients being cared for, where it's vaccinated. Patients around them, once you decide that dotted line, it's also important to keep down the burdens within the healthcare environment. And there are some examples of when you really touch the environment and not the patient. Now I want what should happen when inside the patient zone, inside the line. Once you touch the patient before moment one, you can be alone for as long as you be caring patient and not your hands unless moment of a clean aseptic procedure. And your hands before touching on breach the skin membrane of that patient where they can actually get their system. End of the dotted line, this is critical, is body exposure to protect, help the spread of bodily fluids, and examples when that happens are given here. Just to remember, that zone is what we're focused on. The actions that need to happen while going, also patient when inside their own zone where they are prevalent, that 2 and 3 must occur. By using a couple of WHO documents that will implement all that I said, there's documentation which includes that you can all steps that we've discussed, what you prepare yourself with, to action, tools, to do, and to continue the cycle. Use these documents are very easy to read and use. Your health organisation and make the assessment framework to start other people, other organisations on your journey to improvement and sustainability. Don't make sure and can be a leader in hand hygiene, improvements, patient safety. I leave in some facts where I started about is quality indicator and should now to in healthcare, confident overall quality of care, strategy that's been tested in order to do this. It's not patients such as you see here losing a limb from an avoidable in the campaign, the web is here. Posters that you can use and download, important handiness in the spread of resistant germs. It is hand hygiene hygiene and resistance. So to you, take action to support you. Here at the WHO document, studies in medicine on those are actually explained in the New England Journal of Medicine in order to apply actions, that strategy in practice. So I will continue to take over. You will have slides to refer to all of this information afterwards. And for taking over now to explain his